The arthritis is a major part of our clinical work every day. We see every alternate patient comes with a pain. For any other specialty, for orthopedics, every next patient is again a pain. Among the pain, the osteoarthritis and rheumatoid arthritis constitutes the majority of this. We always look for newer options and safer methods to treat our patients. As you know, the chronic inflammatory arthritis, rheumatoid arthritis, the disease burden, we will discuss in the following. Disease burden, pathophysiology, current options, their limitations, role of novel anti-inflammatory agents. Rheumatoid arthritis is you all know, and you know it's a basic. I'm just covering it, and whatever relevant, I'm just touch that topic, and what is not relevant, and more this pharmacokinetics and dynamics I'll be skipping through. It's a chronic inflammatory autoimmune disease affecting systemically and majority of joints, lungs, heart, and eyes are affected. The pathophysiology that human aggregate factor and interleukin-1 is the mediating synovitis. Production of collagen leads to the destruction of cellular matrix, and MMP, matrix metalloproteinase, are the factors mediating the inflammatory arthritis. Osteoarthritis, the same, again, human aggregate factors interleukin are the major cytokine involved in the pathogenesis of osteoarthritis. And release of this inflammatory cytokine is regulated by the nuclear factor kappa B. So, management of rheumatoid arthritis, osteoarthritis, the inflammation is the main culprit. The meeting it is our priority. So, NFKB activation, rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, psoriatic arthritis, juvenile rheumatoid arthritis. The mechanism of NFKB activation, inflammation stimuli, activation NFKB, translocation of nucleus, activation of gene encoding inflammatory mediators, release of inflammatory mediators. Outcome of NFKB activation. In rheumatoid arthritis, it's a PANAS, the neovascularization. In osteoarthritis, it is degeneration. The current options for rheumatoid arthritis, there will be always a lot of debate going between orthopedicians and the physicians, because both of us are here on the same platform. We want pain relief, you want safety. Our physician friend tells you right analysis, patient comes to us with a renal failure. Our aim is to reduce pain, your aim is to prevent the renal failure and further medical complications. Unfortunately, all effective NSAIDs has got a renal toxicity. You all know it has got patient. We write analysis in the morning. They come with the gastritis in the night and disturb the physician. And it's all hepatotoxic, venotoxic, increased cardiovascular, cerebrovascular risk. Steroids are a wonderful drug, but it has got its own side effects like gastritis, diabetes, hypertension, osteoporosis, increased risk of infection. And we cannot use it forever. Disease modifying drugs, the methotrexate, hydroxyquinone, leflunomide, they should be titrated and it should be patient to patient, has to be effectively monitored, and again it has got its own side effects. And biologics, even though it's available widely, it is costly, prohibitive cost, and it's only intramuscular injections and parenteral, and it has got increased risk of tuberculosis and bacterial infections, demyelinating diseases, cancer, etc. Still, we are to use biologics in a big way. Innovative option for arthritis, curcumin difluramethylene is a innovative product. It is the what I call it as a most biologic, and in a common word it belongs to our haldi, that is turmeric group, and it's a ginger group. As I was talking to Srikanth Gadwalkar sir, I was telling me what I'm, so my topic is on Haldi. Sir told my topic is on Haldi and this, what is Bellary. So it's good that we have the backyard, the available curcumin is further research and they come out with a very innovative product that is curcumin. It has got a good anti-inflammatory and antioxidant, anti-proliferative, anti-angiogenic. There are good clinical studies. Curcumin is a good NFKB inhibitor. NFKB you all know is the mediator for inflammatory arthritis and degenerative arthritis. So prevention, it automatically prevents disease progress and gives a good relief. It has got a multiple action, inhibits IKB kinase enzyme, prevents activation of NFKB, prevents translation into nucleus, prevents release of inflammatory mediators, hence diseases and control. So few studies. Compared study of curcumin with diclofenac. Curcumin provided greater improvement in disease activity scores and ACR scores compared to diclofenac. Here is results. 18 patients with rheumatoid are treated with curcumin for 2 weeks. Curcumin improved joint swelling and stiffness, walking time. Curcumin was very well tolerated with better GI tolerability. Effective and well tolerated. In osteoarthritis, it's a bigger compared to rheumatoid arthritis study. 820 patients attending outpatient clinics were treated with curcumin for 6 months. Significant improvement in pain, improvement in joint consequently better quality of life. Were able to 50% patients were able to discontinue NSAIDs and analgesics, and it's well tolerated. Compared to study with curcumin with ibuprofen, their effect is same. Curcumin is safe compared to ibuprofen. Now of curcumin as a monotherapy, 100 patients with osteoarthritis curcumin for 8 months. Significant decrease in serum inflammatory biomarkers, interleukins and 1P and interleukin 6. Soluble CD40 ligand, soluble vascular cell adhesion molecule. Decrease in the WOMAK score, 3-fold increase in the treadmill walking performance. So patients who are already on analgesics and risk, it can be co-administered with NSAIDs, marked as GI side effects. Combination therapy with curcumin with diclofenac. Curcumin is not alone effective, then with diclofenac, it has good additive effect. Synergistic effect. With the celecoxibs, it has got a good effect. Given combination of testosterone also it works. It can be used as a combination therapy and also monotherapy. Curcumin generally recognized as safe. No noticeable adverse effects observed dose of 8 to 12 grams daily for 3 months. And they can be free from adverse effects and kidney or liver cardiovascular system even after long-term use. Occasional patient may complain mild transient nausea and diarrhea. The conventional, why should not we use turmeric directly? It is not, it's hydrophobic polyphenolic compound, poorly absorbed from GI tract, undetectable in plasma, doesn't reach systemic organs and tissue effectively. So created carried out in conventional curcumin, use high doses of programs, few studies have not shown positive results, poor GI tolerability. So how to make curcumin more effective? The innovative, the drug delivery system, self-microemulsified drug delivery system, they have come out with innovative and novel text. With that, it becomes nano-sized hydrophilic droplets of curcumin and improved absorption, better tissue penetration. So better plasma availability by human pharmacokinetic study. Bioenhanced curcumin summary inhibits master switch inflammation NFKB, decreases the risk of inflammatory prostaglandins and cytokines. Monotherapy found to be effective and safe in the treatment of rheumatoid arthritis and osteoarthritis. Efficacy at par with NSAIDs but better with GI tolerability. When given along with NSAID steroids, provides additive and synergistic action, helps dose reduction. When given along with methotrexate, helps to reduce the risk of hepatotoxicity. Unlike whereas it can be given orally and safe and tolerated. It's an attractive option for many with rheumatoid arthritis and osteoarthritis, particularly useful option in following group of patients. Intolerant to NSAIDs and steroids, disease-modifying drugs, compromised renal function, hepatic dysfunction, cardiovascular disorders, hypertension, chronic hepatic failure. With this, I'll add some more. When all the medical options are exhausted, it can be further taken, and total joint replacement is good for arthritic patients. It's an innovation again. 30 years back, we didn't have an option. Patient used to have the arthritis, take medicines for a life, and intra-articular steroids and all sorts of things. Now we have a joint replacement option. It's a good for arthritic patients. Patient starts walking. And limitation is, at present, it's a prohibitive cost. Need for revision after some time. Surgery-related complication is there still. With this, a small outcome is this: making Bellary proud. After considering, we are all used to love to have good instruments and good implants. As an orthopedic surgeon, I always had a dream to use a good implants and good instruments. With this, when we came to Bellary, when we want a good instruments and good implants, the cost is basically imported one, and the cost is so huge that prevents us from using. We have a desire to use, but the cost prevents us using. So why should not we have an implant which is good and it's also cost effective? I don't call it a cheap, because it should be cost effective, where our patient should be and our surgeon should get a good, innovative orthopedic implants. With this background, we started happy to announce that we started an implant manufacturing factory called as M.J.Shashidha, we call it as McAllis, in Bellary in 2014 November. 2015 November, we will be launching to the market. And we are proud to tell that we are making quality implants at affordable cost. Our mission statement is quality uncompromised at affordable price. We are going to present these implants to the orthopedic surgeons in the next few months. So thank you all. Let's make life pain-free and make more happy.